All right. So we are, I am very excited here because I am going to chat with Dr. Aimie Apigian about stored trauma and thyroid health. And Dr. Aimie is the leading medical expert on how life experiences get stored in the body and restore the body to its best state of health through her signature model and methodology, the biology of trauma. And she is a double board certified medical physician in preventative medicine and addiction medicine. She has a master's in biochemistry and a master's in public health. And in addition to her medical training, she is also a functional medicine physician. And Dr. Aimie has training and certification specifically in neuroautoimmunity, nutrition and genetics for addictions, mental health and mood and behavioral disorders. She has several certifications in various trauma therapies, including the instinctual trauma response model, somatic experiencing, which was developed by Dr. Peter Levine, and neuroaffective touch by Dr. Aline Lapierre. And thank you so much for joining us, Dr. Aimie.
Absolutely, Dr. Eric. I'm really excited for this conversation. It's such an important conversation. So thank you for the invitation.
Yeah, you are welcome. And again, thank you. And I agree, definitely a very important conversation we're about to have. And can you start out by giving your background, how you started helping people with trauma, or maybe really just getting into how you developed your signature model and methodology, the biology of trauma?
Yeah, when you were reading my introduction, it takes me down memory lane of all the different trainings that I've had. And yet at the end of the day, this was actually just for me to save my own life and to try to help my son, Miguel, who I had adopted. So it was while I was in medical school at Loma Linda University. 2008 was when Miguel came into my life. He was a foster child at the time, 4 years old, landed in my home. I thought I knew what to do. I thought that my love was strong enough to heal him of all of his prior wounds that he had had up until that point. And I had so much to learn. And so he was really the one that opened that door up for me. And I made a commitment to him to figure out what he needed in order to just help him be happy. I wanted him to have some happy years in his childhood. And what I saw happening was that he was bringing his past with him as if it were still happening. And my love continued to actually be a trigger for him. And he would be very reactive and not want to even connect with me because that did not feel safe to him. And when I saw that not changing with time, I got very worried about his future. And so I started diving into trauma at that time. It was specifically around attachment, of course, because that's what I recognized was his core issue. But then I went on to general surgery residency after medical school. And it was 3 years into that. So I am finishing up my 3rd year of general surgery residency. I'm actually on transplant surgery rotation of all things. And my body broke. And I got so sick that I could not even get out of bed for a period of time. And I went and I saw, of course, my conventional medicine doctor, and found from my lab results that I had high autoimmune markers, that my thyroid levels were off, but yet not to the point yet where they would diagnose me with anything. They did diagnose me with chronic fatigue just because they couldn't figure out why I was so fatigued that I could not get out of bed. And it took many months. So I actually ended up having to take a medical leave. That's how sick I got. And in the process, what I realized through my studies on trauma, of course, was that all of the health symptoms and conditions that I was having, or at least that I was on the pathway to having, all of them were related to adverse childhood experiences. And I had no idea why, because that was not me. At least I thought that was my son, right? Like my son had had a lot of childhood trauma. I had not. So why was I one of them and having the same health issues? And it started me on this pathway of asking questions around, well, what exactly is trauma? What exactly are those things that happen in childhood that create these adult onset diseases? And through that process, I started learning and tracking my own system, experimenting with my own system, then started all of my trauma therapy trainings, all to help me better understand what was happening in my own body and how to get my life back. Because what I was experiencing was nothing what I wanted my future to be. And that's how I developed all this. Like that's how this started. This was never intended initially to, go out and help other people, and certainly not to start a professional training program where I'm training professionals now around the world in my methodology. This started with me having to figure it out for myself, not knowing, Dr. Eric, not knowing if it could be done, not knowing if as an adult we could actually rewire these trauma and stress patterns that have been in our system since childhood. But I was willing to figure it out and do everything that I could in order to see if it could be done, just to get my life back.
That's some story, and thanks for sharing. And so, when working with any chronic health condition, I mean, people who are listening to this, most people have a thyroid or autoimmune thyroid condition, whether it's hypothyroidism or hyperthyroidism, Graves' disease. A decent number of people will respond just to diet and lifestyle stress management, getting proper sleep, taking supplementation. But then there'll be people who just don't respond. And not to say that with all these people it's adverse childhood experiences, but is it still safe to say that at least in some of these people that it's that's playing a role in them not recovering or not getting the results that they're expecting to get or I expect to get?
Well, I may say something really controversial here that many people might not want to hear me say, but this is what I have found, that when it comes to these chronic diseases, especially autoimmune, all autoimmune conditions, Dr. Eric, all of them, all autoimmune fall under the category of being trauma related, not stress related, trauma related. So that opens up this whole can of worms to be like, well, then when would you have experienced trauma? Well, we need to redefine trauma, because just like me, you may look back on your life and be like, me? I haven't had trauma. I relate to being stressed, but not trauma. And I had to relook at what is trauma actually. And there's that's why I call it the biology of trauma. There's a whole biology of trauma. And autoimmune conditions, all autoimmune, are squarely in the freeze response or that trauma response category.
So that brings us to the question, what's the difference between stress and trauma, which I know you're going to get into. So why don't we just dive into that right now?
Let's do it. So this is a really important distinction, and most people aren't aware of this distinction. And in fact, most professionals, even practitioners, you will still hear them say, oh, fight, flight, or freeze, as if all three of those are the same, and they're not. And what is happening is that many people are being diagnosed per se with stress or even chronic stress when they should be diagnosed with trauma. And you are in a trauma response. Your body is chronically in a trauma response, not a stress response. So here's the difference. There are three ways that you can tell the difference between stress response and a trauma response. One is your body sensations. One is your thoughts, the thoughts that you're having. And the other one are the physical health conditions or symptoms that you're experiencing. So let's just go with body sensations first of all. When you are in a stress response, it is that state when you are actively running or facing and fighting the danger in your life, whatever that danger is, whatever that problem is. It is when you are running from that dog who's going to bite you. It is when you are racing towards your meeting in order to get there on time. It is a very high energy state. Your senses are very alert and tuned into the problem and what are all the different factors contributing to that problem, and what do I need to do to face that problem. Stress response is when you don't want to go to bed because you actively have a problem and you want to solve it and you're taking action to solve it. The trauma response is when it feels like things have been so much, too much, and all you want to do is go to bed. In fact, You don't want to get out of bed. You want to pull the covers over your head. There is a problem in your life, but it feels like you don't have the energy to face the problem. There's this sensation of a collapse of energy, low energy. In fact, when you feel into your body, it's when you want to curl up into a ball. Whereas a fight response is no, like I'm going to fight you. And the trauma response is I'm done fighting. I don't have the energy to fight anymore. Now, I may still go through the motions because I still have responsibilities. I still have a job. I still have kids. I still have a partner. I still have life. But that's what it feels like. I'm just going through the motions rather than experiencing the aliveness and the energy and the joy and feeling like you're actually present and engaged. The trauma response will have you feeling like you're distanced, like things are a little foggy, things are a little numb. You don't feel like you belong. You feel like you're on the outside looking in, sometimes on your own life, let alone in a group of people. You can be surrounded by a group of people and yet still feel very alone. That is the trauma response. And that's the difference between stress and trauma.
So if someone is dealing with chronic stress, oftentimes you'll hear practitioners, and that includes myself, talk about blocking out time for stress management, incorporate mind-body medicine, whether it's meditation or yoga or biofeedback, Tai Chi. Again, there's so many different types of mind-body medicine techniques. But is it safe to say then with trauma, that's not the solution? And I know you'll talk about some of the solutions, but I guess maybe let me reword it a different way. Does mind-body medicine play any role when it comes to trauma, or is it just really for those who are chronically stressed?
Like you say, there's a lot of different modalities. And so rather than focusing on which modality, I teach the principles of what the trauma response needs in order to come out of the trauma response. And what does the stress response need? Because those are two very different things. And when we think that it's stress and we apply tools for stress, but it's actually the trauma response, those tools aren't going to work. And that's when people can get stuck or they experience resolution of those physical health symptoms, but then other physical health symptoms appear. And I've seen this quite often in people who do some of these different modalities, that maybe their gut issues resolve, maybe their thyroid issues resolve, but then it shows up as something else. It shows up as chronic pain. It shows up as inflammation somewhere else. Like it always shows up somewhere until we actually work with and resolve the true underlying and root cause. So what the trauma response needs, three things. The trauma response has to have a felt sense of safety. I'll come back to that because that's actually can be tricky for some people. The other things that the trauma response needs are time and energy. So the trauma response is an energy problem. So that's where the biology factors come in, and we need to look at all of the things that are draining our energy, that are contributing to us continuing to go into the trauma response. That it's become this conditioned pattern where now we just go automatically into it without really even needing a trigger, because that's just what we're conditioned to do. And it needs time. So there are two triggers for the trauma response. One would be when things happen too much, too fast, and the body hasn't had time to process what's happened. It hasn't had time to integrate what's happened. It overwhelms it, and it goes into the trauma response. The trauma response is, in a sense, our protective adaptation to just buy us some time. But then it needs a felt sense of safety. And if you were a turtle and you had, danger approach, and you pull your head back into your shell, that's kind of like the trauma response, right? Like we pull things back in, we close up, we retreat within ourselves. We're not sticking our head out until it's safe outside, because we don't want to get our heads bitten off. That's the same thing with the trauma response. We're not going to come out of that trauma response until we have a felt sense of safety. But here's the problem. So many people live in their heads and they're used to thinking about things and talking about things and analyzing things that they have no idea that they actually don't feel safe in their own body. They tell themselves that they should feel safe. They maybe even say affirmations and mantras and do mind-body medicine that tells them. But is it a felt sense? Do they actually feel safe in their body? Because until that is in place, the body itself will stay in its trauma patterns. Doesn't matter what the mind does. So when we look at the different modalities that are out there that can help us, that's the question that we want to ask. Does this help me create a felt sense of safety, time, and energy? If so, then it's the right tool for the trauma response. If it doesn't, it still may be the right tool. It's just not the right time to use this tool, because the stress response needs different tools, and those may be better tools for the stress response. But we're not in the stress response yet. We're still dealing with the trauma response. And anybody with active thyroid issues, especially autoimmune, is in the trauma response. That trauma response, when you look at the symptoms, unless you have, like a thyroid storm, and then you're clearly in the sympathetic stress response. But otherwise, if you have any version of hypothyroidism, the fatigue, the heaviness, the low metabolism, that is all symptoms of the trauma response. It doesn't need to be emotional. It can be our biology that pulls us into that trauma response.
Very interesting. So it's not just emotional trauma, but so really you're kind of explaining that connection, that sounds like, between the physical trauma and emotional trauma, because that's one of the things I wanted to ask
It
you
can be both. And so, when we look at the adverse childhood experiences studies, and for those who may not be familiar with those studies yet, I encourage you to go look at those. They came out of the work of Dr. Vincent Folletti and San Diego Kaiser, actually working with obese women and noticing that a high percentage of them had had sexual trauma in their childhood. And so it opened up this question for him of, wait a second, is there a connection here? And he was willing to ask the questions that no one else wanted to even ask, let alone talk about. But since then, it's opened up all these other questions of, well, if that's the association with obesity, what about with autoimmune thyroiditis? What about Hashimoto's? And yes, there are clear connections between adverse childhood experiences and autoimmune thyroid conditions. There's a great paper that came out in 2009. The last name of the person who wrote the article is Dube, D-U-B-E. And if you just search under adverse childhood experiences, thyroid 2009, D-U-B-E, you'll find the article. And it's a very clear association. And what they also found in that is that it's not only the association with the thyroid issues, but it's also the severity of symptoms that you are likely to experience. The more stress or the more adverse childhood experiences you had as a child, the more that predicts that you will even be hospitalized for the severity of your thyroid symptoms. There's another article that's just recently published in 2018, and this was looking at subclinical hypothyroidism in pregnancy. And what they found is that the childhood stress or abuse is associated with increased risk of mothers experiencing subclinical hypothyroidism when they are pregnant. This was published in the Journal of Psychoneuroendocrinology in 2017. And then there's another article that's on post-traumatic stress disorder and the incidence of thyroid dysfunction in women. That one was published in 2018 by Cambridge University Press. And they found that there is this association between the diagnosis of PTSD having a higher risk of hypothyroidism. Well, of course it does, because the hypothyroidism by itself puts us into a trauma response. And so we see these connections that the earlier in life and the more times in life that you have experienced overwhelm, that's what actually promotes the nervous system changes that cause the immune system changes that cause autoimmune. Stress does not cause autoimmune. The trauma response is what causes autoimmune.
Very
And
interesting.
the autoimmune causes the trauma response. So it goes both ways.
Yeah, thank you for sharing those studies. And if you have links, feel free to
Happy.
send them to me. I'll put them in the show notes. And so, obviously, you brought up these examples because you know my audience consists of people with thyroid and autoimmune thyroid conditions, but it's not just if you did the same studies on multiple sclerosis or
Yes.
lupus or whatever even maybe
They're
rheumatoid
all of
arthritis.
the autoimmune. Like, you can't ignore the facts. And that's why when my autoimmune markers came back high and my doctors wanted to just make it, insignificant, be like, well, you haven't had any of the clear symptoms yet. So once you have those symptoms, come back and we'll diagnose you with lupus. And I was like, well, how do I get off of this path? Because I don't want an autoimmune condition for the rest of my life, but I'm clearly on this path. And that's what my studies led me to. Like, Aimie, you can't ignore the facts. Like, this is related to what I thought at the time was stress, and what I've since learned is actually the trauma response. And so that became my focus of how do I work with my trauma response so that it is no longer driving my health.
Yeah. So can you talk about some of the things you do, like some of the, therapy modalities or, ways that you do to regulate, methods you use to regulate the nervous system?
Absolutely. So in the approach that I have created, which again is the biology of trauma, there are 3 arms to this approach. One arm is what I call somatic work or body work. This is where I use my mind to put attention on different sensations in my body so that I can be aware of what's happening and provided a felt sense of safety, which is what the trauma response needs, provided a felt sense of support, which is what the stress response needs, and then be able to provide it a safe experience of growth and expansion and joy and healthy anger and boundaries and all of these other things that autoimmune people need to work on as well. And so that is one arm, the somatic work, which is working with the body sensations, using the mind to put attention on the body. And then the other arm, another arm, I should say, is our thoughts and our belief systems. And I classify this as parts work. So anybody who's familiar with internal family systems, this is how I frame this. And there's different parts of us. There are, the part of us that experienced a situation in life, and what were the belief systems that we made coming out of that? What were the stories that we told ourselves about ourselves coming out of that experience? Because those now have continued to drive our belief systems about ourselves, our views of ourselves. So I actually incorporate parts work and our belief systems with the body work so that they are actually done together. And then I bring in the biology piece because, as we can see, whether we're talking about stress or trauma, but trauma especially has chronic effects on our biology. And so now it's no longer enough just to go back and try to process the trauma, which I'll mention that we actually can't process trauma until we have some tools in place. But we can't process that trauma and expect everything to be resolved, because now we've had this downstream effects, and it's our biology that will keep us stuck. So we also do need to address how our biology has been affected by the trauma. So the tools that we have to use include what we call regulation. And regulation, you can think of it as just stabilizing the body. So, I did 3.5 years of general surgery residency. So when a person goes into surgery can be thought of as like processing trauma, right? Like, we're actually going to fix the problem. We're going to rewire the nervous system. We're going to do this big release or whatever it is that we're processing. That's like what happens in surgery. But you don't just take anybody to surgery at any time. You have to do a pre-surgery assessment. Are they ready for surgery? Are you ready for processing that level of trauma, that depth of trauma? Or are we actually going to re-traumatize you by trying to help you? And that's what a lot of therapies do. They try to help people process when they're not yet ready to process. We haven't stabilized the system yet. The system, the body has to be stabilized to go into surgery. You wouldn't go into surgery without anesthesia, right? Like that, you would create more harm than good. And that's what we do with therapy so many times. We're trying to do good, but actually putting them in a place where we're asking the body to do more than what it's prepared to do at that time. It's not yet stabilized, doesn't have the tools yet. And those tools are called regulation skills. And the short of it is the regulation skills are the body work, are being able to shift my own states of my nervous system, to be able to recognize when my system has gone into the stress response, when it has gone into the trauma response, and have the tools in the moment to create a felt sense of safety, or to create a felt sense of support, or to bring my system back into parasympathetic. So many times we have relied on other people to do that for us. Whether it's a therapist, whether it's our partner, whether it's our friends, we have relied on other people to help manage our emotions, to help stabilize us, to help bring us back down to a place of settling and feeling okay. We go to therapy, in fact, in order to help us feel safe in an area of life that we don't feel safe. And that's why the therapy doesn't work, no matter what modality you use, because a person needs to go into therapy feeling safe for their body to actually be ready and open and able to process what happens in that therapy session. Otherwise, we can re-traumatize people by, even of a good thing, causing too much too fast. There was one other trigger for the trauma response other than too much too fast, which is too little for too long. Too little of something that you need for too long. And whether that's too little of support, too little of love, too little of touch, too little of whatever it is. Too little for too long is the other trigger for the trauma response in our life.
Wow, this is quite a process. And, so you said to see a reason why therapy doesn't work, or if someone goes to a psychologist, is that they need to feel safe prior to seeing the therapist or psychologist. And then I guess on top of that, they're not dealing with the biology, they're just dealing with the psychology too. So that's why someone might be seeing a therapist or psychologist for months or years, and just, I mean, maybe they are getting, a little bit of progress, but just not, where they could be by seeing someone like you who focuses on the whole picture.
Yeah. And one thing that I discovered that I'd love to share with your audience is how to know when the therapy that you are doing is actually re-traumatizing you. And sometimes we are not aware enough of our own bodies yet to be able to recognize that, but it shows up in our health. And so if you are experiencing a flare up of your physical health conditions, of your chronic health conditions, for me, I would experience a flare up of my autoimmune stuff. And I would wake up and I would feel inflamed and my gut issues would flare up. Those are signs that what you are doing is too much for your body. And you're actually re-traumatizing yourself. And that's how it's manifesting. That's how it's expressing. That's how it's trying to talk to you and get your attention of, this is not the right thing at this time, or this is too much too fast for us. So we can use our physical health as a measure, as a monitor for how we are doing any therapy process, and whether it's helpful or whether it's maybe a good thing, just not the right thing at the right time.
So after someone works with you, or while someone's working with you, I guess I'm still I have a background. A lot of people don't know this, but my bachelor's actually is in psychology. And, so, when if someone works with you, then is it completely unnecessary to see a therapist or psychologist? Or in some cases, is it still beneficial to, see someone in addition? Or
Yeah, that's a great question. And I'm not going to say that no other process is going to be helpful. What I do, I don't call what I do therapy, because what I'm doing is I'm teaching you how to give your body what it needs to heal itself. And that's very different than going to somebody else and saying, will you please fix me? And part of the trauma response, Dr. Eric, is that naturally, this is a natural part of the trauma response, is that we lose our own sense of power. We feel powerless. We feel like it's too big for us. And so it's a very important principle in my methodology to empower people and teach them so much of what they can do for themselves. And it is my belief and my experience, and certainly with the, oh my goodness, thousands of people now who've come through my courses, that when they have the skills to do a lot of this themselves, the rest becomes clear. And for some of them, they're good. Their health conditions are better. We've had some come through with their thyroid levels off, and they come through and they regulate their nervous system and provide a felt sense of safety and support, and their thyroid levels come back to normal. It's been phenomenal, the health changes that even happen. But for some people, it becomes clear to them that this over here is another piece that I'm missing. This is a piece that is the next best piece for me. But what allows it changes the feeling of being lost, and I don't know what to do, so I'm just going to randomly pick something and hope that they know what they're doing. And this process changes that, where now they're making decisions that are coming from a place of clarity. I can tell what my body needs. I know what my body needs, and let me go find someone who will fit that piece and be able to do that for me. It's a very different place than feeling like you're just spiraling out of control and grappling for something, someone, somewhere that can help you, versus I know my body. I'm an expert on my system. I'm an expert on my trauma. And I know that this is the next piece for me, and let me go find that specific person. It's completely different. It's such meaningful work to see people go from a place of feeling very lost, feeling very broken, feeling very lost, very broken, and being able to see that through this process, they come to their clear path forward.
And I guess this is important, not just in regaining someone's health, but in maintaining their health too, because you mentioned before, like flare-ups will happen, and obviously you can't undo the past, the traumas that people have experienced in the past. It's just, yeah. So yeah, I mean, thanks for explaining that. So it's just like, so someone who's listening to this and they're dealing with, again, whether it's Hashimoto's or hyperthyroidism, Graves' disease, and they're maybe they just haven't gotten the results that they expected by just changing their diet and doing other things that I teach on the podcast and other functional medicine practitioners teach. So what are some next steps that you would recommend them take?
I would recommend them start to look into the trauma. I know this is scary and it can be daunting to look at, okay, now I've got to do trauma work, or maybe I've been doing trauma work, but I realize I've been doing it wrong. And so I've created a starting place for people. So that can be a helpful place. It's a starting place for doing this type of body work, this type of trauma work through the lens of what were the overwhelming experiences that I've had in my life. And let me just start with the superficial layer. Let me actually do things gently. Let me actually learn how to build in these felt senses of safety and support, rather than what I call jumping off the cliff of, the emotions, where hope you have your parachute, because that can be a hard landing if you're just trying to go in to process something. So I have starting place retreats, and I do those over a weekend. So it's on a Friday, Saturday, Sunday, very low time commitment. We meet for 30 minutes on Friday, an hour and a half on Saturday, hour on Sunday. It really is just the starting place to show people this is what this type of trauma work means, so that you don't have to be afraid of it. You know what it's like. And then they can make a decision to continue on with me, or they now have a better sense of what it is that they need. And they sometimes go and find that in their local area, someone that they can meet with in person. And they don't do an online course with me. I do a 21-day journey for those people who want to do that journey with me and have me guide them into their own body, into their own nervous system, and start to become the experts of their system. So there are options, but they need a starting place. And so that would be my strong recommendation is get to know what it is that you actually need, what your body needs. And then from there, things start to become clear. So if that's coming to my starting place retreat, come to my starting place retreat and just experience it, and then be able to make a better informed decision of what do you want your next step to be. Do you want it to be one of my longer courses? Do you want it to be something in person, but now you have a better idea and sense of what exactly it is that you're looking for, and how gentle or fast your body is ready to go? Because that is something that each person needs to know in order to keep it safe and not have it be an experience that re-traumatizes them.
So the 3-day retreats, those are in person, not virtual. Is that correct?
Those are all virtual.
Oh, those are virtual. Okay, so anywhere people could
Yeah.
do. Okay, great. And then you mentioned the 21-day program. That's obviously that's online, and so anybody can do that as well, correct?
Yeah, and the 21-day journey is what I designed to that I was taking all of my patients through. So at that time, I was still having my own clinical practice, and I noticed that if I could teach them these skills first, their health, their baseline was at a very different place, and we could do so much more and faster with their actual medical care. And so I started having all of them do just 21 days of some very simple, basic somatic work. These are short exercises. So I teach these exercises. They're 10 minutes every day. But the whole first week in that 21-day journey is me teaching them different exercises, 7 different exercises to create a felt sense of safety. And this is where most of them tell me, I didn't even know that I didn't know what it felt like to be safe. I didn't know. The whole second week is me teaching them 7 different exercises to create the felt sense of support. Because when you feel like someone has your back, my goodness, you can do anything. We're able to stay in that stress response and not have our stress turn into trauma because we felt all alone and that no one understood what we were going through. And then the third week of that 21-day journey, I teach them different exercises on how to safely step into growth and expansion and joy and healthy anger and boundaries, all of these things that we need to bring into the trauma work, but we also need to bring it in at the right time. And that's never at the very beginning. We need to create a felt sense of safety and support first, and then we can move into these more expansive things.
Would you say this is something that everyone can benefit from, or just
Every single person. Yes,
you mentioned before? I'm asking because you said really especially those with, let's say, an autoimmune thyroid condition, Graves, Hashimoto's. You said every autoimmune condition,
Yes.
trauma is a factor. So it sounds
Yes.
like it is
I
something.
mean, who in our life today does not experience stress and overwhelm? Everyone to some degree. Everyone to some degree. So this like, I really do consider this like, this is just the manual for our human bodies and knowing what our bodies need to get through life in the most healthy way possible.
Yeah. So I probably need to go through that too then.
I would love to have you in it.
Yeah, I should have asked you, is there anything, I know we covered a lot, but is there anything that I didn't ask you that I should have asked you? Anything else that you like to chat about?
We covered a lot. And I imagine there are some people who already feel overwhelmed with all that I shared. And I just want to share hope, right? Like, there is so much hope, no matter how old you are, no matter how far you are in your disease process, no matter what, no matter how your life experiences have been up until now. There is so much hope, and it's just using the right tools in the right way and in the right order. And that's what we have not been doing, and that's what will give us so much more freedom and change for our future.
Well said. And thank you. Thank you so much, Dr. Aimie, for sharing your knowledge on trauma and also relating it to, thyroid health and thyroid autoimmunity. I'm sure the listeners learned a lot, and I did as well.
Well, thank you. Thank you so much.